Welcome back to Straight Talk with Dr. Erik. And I have a very dear friend here with me today.
My name is Tino Negri.
Tino, tell me a little bit about yourself.
So I happen to be one of the owners of a company called Comfort Care Senior Services. Okay, so Comfort Care is a national franchise. There's about 250 of us in the Comfort Care system all over the country. We've been doing this for close to, Scott started the business almost 15 years ago. Allison and I came on about 13 years ago, and then Melissa came on a couple of years after that. So
interesting. And tell me, what does Comfort Care do?
Comfort Care is, what we do is we employ caregivers. Okay.
Yeah.
So what our caregivers do, okay? They assist with basic ADLs, which is activities of daily living, right? So you got bathing, dressing, ambulating, toileting, feeding. They also do IADLs, which are more instrumental activities of daily living, like light housekeeping, medication reminders. They do a load of laundry. They can change the linens, take clients to and from their doctor's appointments, take them out shopping to Publix, or go or run errands for them or with them. So everything I just mentioned is non-medical private duty home care, which means Medicare does not pay for it. Okay. So,
well, it didn't pay for it up to a point, and we'll talk about that
that's
today.
what I want. This is where you come in.
But it's interesting, though. That's true that we do come in. But what's interesting, so it sounds like you have experience with a specific population of patients and caregivers who have dementia.
Yeah. So 13 years ago, when I came down here from New York, if you couldn't tell by my accent, that's where I'm from. Okay. I had a restaurant at Huntington, Long Island, and I met my wife there. And we got married within that year. And then Scott gives me a call, says, hey, I could use you as a partner down here in South Florida. Would you come down? I said, absolutely. So I came down, first week in the business. He says to me, I need you to become an expert in Alzheimer's disease. I said,
and this is coming from a restaurant business.
Yes, I was in hotel management. I sold semiconductors for 20 years, and then I had a restaurant. But there was always something missing in my heart. So when he asked me the question, I said yes, thinking I'm like, yeah, why not? But that decision could have went either way. I mean, I was getting in business with my brand new wife and in-laws, but it was the best decision I made because it led me to all these people who I'm caring for right now. So first week in his business, he says to me, I need you to become an expert in Alzheimer's. And I thought it was a coincidence, and I'm not one for coincidences. I always say coincidences are nothing but God's way of staying anonymous. So 100%. What he did not know was that all 4 of my grandparents had dementia. So I looked at this as my calling. So I became a national certified Alzheimer's educator by the NCBAC. Allison and Scott are also nationally certified educators as well. But I took it another level. I got Department of Elder Affairs certified. I train professionals on this disease. I sit on the council for Dementia-Wise, which is a national program that teaches caregivers, both professional and non-professional, on how to speak this language of dementia. Okay?
Very, very important.
And it is. It's huge.
Because it's a different language.
Totally different language. And right now, I am hosting, free of charge, for family caregivers who are living with their loved ones with dementia, 15 support groups that go from Broward County all the way up to Stewart. My job as an educator is to give these people tools to help them live their best life possible so their loved ones can live their best life possible, right?
It's very, very important. And you've actually mentioned, Tino mentioned that 4 of his grandparents had dementia.
Yeah, but back in those days, they didn't call it Alzheimer's. They called it senility.
Right.
Right?
Right. And what's interesting is that, you know, I'm a big believer in numbers because I feel numbers are very, very important. So we're going to put some numbers up there for the audience to see.
Yeah, that'd be great.
In the year of 2020, Tino, there were 580,000 people, more or less, in the state of Florida that were diagnosed with dementia. Now we're in 2025. And I'd like to ask the audience, how many people do you think it's estimated have dementia in the year of 2025? We'll give you a couple of seconds. Ready? 1, 2, 3. 720,000 people, Tino, are estimated in 2025 to have dementia. Now you're going to say, well, that's interesting. How do we know? Well, another interesting point, Tino, is that 40% of primary care doctors and clinicians say that they feel uncomfortable or lack the tools to actually diagnose dementia. So let's do the math. If you have in 2020 580,000, in 2025 we're saying 720, but 40% of clinicians saying I'm actually not comfortable making a diagnosis, is it really 720,000 or is it a lot more?
A lot more.
It's a lot more.
It totally is.
And another interesting statistic is that from 580 to 720, what percentage increase of dementia has there been? 24.1%, almost 25% increase. That is huge.
You know why?
Why?
People are living longer.
Right.
You know, back in my day, my grandparents were dying off in their 70s. I thought that was old as a kid.
Right.
Now that I'm 55 and approaching this, I'm
Yeah.
like, it's not old.
It's not old. My grandma's 92. My other grandma who passed away was 95.
Yeah, yeah. The one who my mother took care of, my grandmother, she passed away at 94. She was the only one that lived that long. But all the rest of my grandparents were in their 70s. And my grandmother was the one that lived that life in dementia. Like I said, they didn't call it Alzheimer's. They called it senility, hardening of the arteries, whatever. But she shared the same behaviors that I see every day. It's not easy. It wasn't easy for her.
It's not easy for her, and it's also not easy for the caregivers. And
Yeah.
some of you listening may actually be a caregiver. And this is interesting statistics in the state of Florida, right? This is coming out of Tallahassee.
Yeah.
Tino, 827,000 is the number of caregivers in the state of Florida. And that's unpaid caregivers in 2022, unpaid. And if you're looking at the total hours of unpaid care, that's 1,301,000,000 total hours of unpaid care. And then if you want to convert that to dollars and cents, that's 23,409,000,000 total value of unpaid care. That's on the financial side, Tino. Now let's take a look at the caregivers. Number one, 66% of caregivers themselves have 2 or more chronic conditions.
No doubt.
30% have depression,
No doubt.
right?
Every day I see it.
And it's honestly, it is very, very huge. I know my family, my mom, my dad, they're caregivers for my grandma. My mom and dad are close to 70. They're 69. Grams is 92.
Yeah.
And think about it, 70-year-old taking care of a 92-year-old. Sleepless nights,
Yeah.
right? That could take a toll.
No doubt.
And that's why Medicare came out with a program called the Guide Model.
So let's talk, because I'm so excited, and I'm actually looking forward to keep getting a copy of this podcast so I can blast it out to every caregiver
Yeah,
I
for
know,
sure.
because they really need any information I can give them on any tool that can help them through this journey. When Guide came out, I was like, this is awesome, right? So I couldn't wait
Right.
to get together with you. So why don't you tell everybody what this Guide program is all about?
Right. So the Guide program is known as the Guiding and Improved Dementia Experience, right? And it's an 8-year model, right? We start in July of 2025. So we start in a couple of months. And it's a Medicare program. So you're going to say, okay, Dr. Erik, well, it's a Medicare program. Who qualifies, right? So if you or your loved one have straight Medicare, no Medicare Advantage plan.
Talking A and B now.
Yeah, A and B,
Right.
no Medicare Advantage
Right.
plan, no hospice, no PACE, you're not in a nursing home,
Right.
right? And you have straight Medicare, and you have a diagnosis of dementia,
Right.
you qualify. It's a national program.
Mm-hmm.
There's around 280 of us in all of the United States.
Mm-hmm.
There's around 30 of us in the state of Florida. Now think about it. 30 of us for 720,000 people
That's a lot.
who have the diagnosis of
Yeah.
dementia, right? And this is a partnership between Medicare and between folks like us, MedBetter Health. Now, you're going to ask me, okay, you tell me who qualifies, but what is Guide?
Right.
What can you do for me?
Right.
Right? Someone watching there is like, all right, this is great, guys. How can you help us
Right.
at home on the
Right.
field? So let's talk practical.
Yeah.
The Guide has 2 specific arms. One is respite care. So what does that mean? You, Tino, are a professional when it comes to taking care of folks in the home, right? And you provide people in the home who are specializing in the approach to people who have dementia because it's a special language. Now, let's use an example. You, Tino, are a caregiver. You have a grandma, and you are exhausted.
I've been there.
Right? Yeah, and I'm sure a lot of people listening have been there too, right?
Yeah.
You are exhausted. And so now our care navigator is speaking with you and saying, Tino, let's do some tests to see how exhausted you are. You answer some questions and you're like, right? The meter's right there.
Yeah.
So, okay, Tino, how would you like it if you had a home care agency that we, MedBetter Health, would partner with, like Comfort Care, right? And that agency would come to your home and give you respite, meaning 2, 3, 4 hours a week while you're not there, someone to fold the laundry, to do the clothing, to cook something for grandma, just to give you some time to play basketball or relax or spend time with your family. Play golf. Golf is your game, right? You're like, yeah, I'm not playing basketball.
4 hours to get on the golf course so I can get away from that monotony.
And clear your mind a little bit.
It's respite, like you said, but it's taking care of you. A lot of caregivers, they put that oxygen mask on everybody else. What they're not doing is putting it on themselves. And you're talking about these people who get an MCI when you're not eating right, sleeping right, sleep deprivation, right?
Yes.
They're not checking out their blood, like B12 levels and D3. We were talking about this last time, right? Iron deficiencies. When you're not taking care of you, you're wondering, you're getting a cognitive impairment. You're like, oh my God, it's happening to me. But there's reversible dementias out there.
Correct.
So why in the world wouldn't you take care of yourself? And self-care is the biggest thing because caregivers, they're burnt out. I always tell people, when the dementia who you're caring for starts to get this big, you need to spend this much time with them so you can love them that much more.
Right.
Problem is, caregivers, they put this on their own shoulders and it weighs them down and it crushes their spirit and they fall down this wormhole of isolation and depression.
And this is the first time that Medicare comes out with a program that identifies that it's not only the patient, but it's the caregiver that needs assistance. And you mentioned something pretty interesting in that when you're on a plane, what do they say? Before you put on the oxygen mask, right? Put it on yourself first before you put it on your children. And in these cases, sometimes grandma, grandpa, or parents become, because of their cognitive decline, into that cycle. So that's one. So imagine if I were to tell you, Tino, Medicare will cover $2,500 worth a year. And you know what? That's a lot of help for people. That's number one. The other option is adult daycare. What if your grandma's sitting home and she's home the whole time and you're like, man, I just wish for like 8 hours a day, once a week, grandma can go to a daycare center.
Yeah.
That's covered now through Medicare.
Yep.
Or let's say, Tino, you need to fly out to California or New York because you're marrying off your daughter. But you're like, what do I do with grandma? Where do I leave her? Because I have to give her her meds. I take care of her. Medicare now, through Guide, through our organization, will partner with assisted living for short-term ALF, assisted living, respite care.
That's fabulous.
Right? It's really incredible. So that's one arm.
Right.
What about the other arm, right? That's the medical and the care navigation arm. Let's use your grandma again.
Right.
Your grandma is taking 19 meds. 3 of them from a neurologist, 6 from a psychiatrist, and then 10 from a primary care doctor, right? As we all know, not all the time do they all talk to each other.
Nope.
Right? So what does the Guide model provide? A Guide model provides a care navigator and a dementia proficient clinician who are going to review the meds and be like, 5, 6 of those meds, they're no good. They're actually interacting and they're actually making the dementia worse.
Yeah.
And the care navigator and the dementia profession clinician will call the specialists, will call the primary care doctor and be like, hey guys, you probably don't know, but these meds, can we tweak it a bit? How huge is that for someone like you who doesn't really know those meds?
It's so true. And, sometimes even pharmacists, they know more. If you just bring them all your medications, they're like, you're combining this with this and this. They're actually really good resource for people.
Yes.
Most people don't realize that, but they are. But
it is. It is. So that's the medical aspect. Let's continue. What about if, Tino, your grandma ends up going to the hospital and you are looking at the discharge paperwork and you have no clue what needs to be done now because it's written in Greek for you, right? What if you had a care navigator who looked through those paperwork, called the hospital doctor. Not only that, took that paperwork and sent it to your primary caregiver, care doctor.
Yeah. You have a one-stop shop with somebody, almost like just someone like a care manager, like you said, that can handle all of that for you. It takes the stress off of you. One phone call.
Yes.
Is that what you're asking?
That is yes.
Okay.
How would you feel?
I feel awesome. You kidding me?
That's what the guide model is designed to do. Here's another scenario, right? Because we're so passionate about this. Tino, you're home and you're telling your grandma, Gram, you gotta take a shower. And she's like, I'm not taking a shower. And again, you go, Grandma, it's been a week. You have to take a shower. I'm not taking a shower, I told you. Now, you don't know what to do. Who are you going to turn to? In the guide model, 24/7, you have access to our team. And no one really thinks about, why do you think your grandma doesn't want to take a shower? Now, you have experience because you're
because I'm an educator, but most people don't.
Share it with our audience.
Well, most people, you understand, grandma, number one, when you're losing short-term memory loss, right? She doesn't remember that she didn't take a shower. She thinks she took it that day, right? So most people who have dementia, they're just thinking like, I already took my shower. Why are you bothering me with this? And on top of that, caregivers are so frustrated, they're dictating. And they're saying, they're correcting her, and they're arguing, and they're reasoning, and they're testing her. And then at the end of it, what does grandma say? Out of 10 times you ask her a question, 7 out of 10 times she's going to say no. So there are tricks about learning this language of dementia where I come in that we don't have time on this podcast to do. By the way, if anyone's interested, you could always reach out to me, and I would love to have you one of my support groups to help you with this language.
And these support groups are free of charge.
Free of charge. It's my way of giving back, and I wasn't there for my mom when I was a kid. Matter of fact, I can care less what was going on with grandma. I had enough problems of my own. Right. So I kind of let my mom do what she had to do, but she didn't have support groups back then. No workshops, no conferences that she can go to understand this language. She had nobody. Right. And if I would have known then, Dr. Erik, what I know now, I would have treated my mom differently, and I would have treated my grandmother differently.
Well, now you have a chance to give back.
This is my opportunity.
Through some of the work that you're doing.
Nobody cares how much you know until they know how much you care. And I absolutely care about my family caregivers.
No, it's huge. And, going back to the shower example, one of the things that we've learned, what is the reason people with dementia don't want someone else to give them a shower? I think about myself. I have kids. Now, would I feel comfortable undressing, showing all of my private parts and privacy to my son or daughter?
Time. Absolutely.
No. So there are tricks of the trade, right? How do you make that experience? How do you make it more comfortable experience for your loved one? So imagine if you're a caregiver and you don't know and you need help and you have access to folks like ourselves at Med Better Health. You have access to Comfort Care and other organizations like the Alzheimer's Association that we have relationships with, that we can help you and navigate you to those resources. Yeah. That's priceless.
Yeah, so it is priceless. It is priceless. So now that you're talking to me about this, and it almost sounds too good to be true, I would say, so what's the catch? Is there a catch?
So there really is no catch.
All right, so let's get that question out of the way, because a lot of people are going to ask that question. What's the catch? So we know what qualifies. We got that out of the way. We know what these two different arms are and what they could benefit.
Correct. And it doesn't cost anything, again, to the patient or the caregiver.
Right.
This is as long as you have Medicare, it's free for you.
And they could re-qualify for it every year, right?
Every year.
And they can use that lump sum. We don't suggest this, but they could use that lump sum all in one, which we don't recommend. We like to see if we can spread this out. Why? Because caregivers, they need that break ongoing, right?
And that's we work with the caregiver and the family to see how much they need. So for example, if it is a lump sum where they have to go away somewhere and it's an emergency and they need to have a 10-night stay at an assisted living and they use that up, that's a possibility. Or it could be where, you know what, I'm so burnt out, Tino. If I can have someone here with me for 3 or 4 hours a week, at least, even if it covers half the year, and then I can cover the other half the year, it's already a huge support to me because I have half the year covered and I only have to cover the other half. Me and my brothers and sisters can contribute to only cover the other half of the year.
That's awesome.
And that's incredible.
It is.
It's really incredible.
It is.
So if anyone is interested in the guide model, we have partnerships. For example, we have partnerships with Comfort Care, where if you need respite care, you would be a guide model beneficiary, right? Mom or dad would sign up, and it's very simple. You'll have some information on the screen of where you could email, where you can call to inquire more. And then if you do need the additional respite care, we work very, very closely with many organizations, but we trust Comfort Care a lot.
I appreciate
that.
that.
One of the folks who we do work with and we do trust, I can count on my hands. You guys are
You and me
definitely,
both.
you guys are one of them.
And I wouldn't be here doing this podcast if I didn't have the utmost faith and trust in you too, Dr.
Thank you.
Erik.
Wow. That means a lot.
No, I'm serious about that. And I can't thank you enough for having me here today. Did we miss anything? Or are we good?
No, I think we're good. It was a pleasure to have you
Yeah,
on.
man.
And I look forward to helping a lot of people, a lot of families together.
I look forward to our journey and their journey as well.
Sounds like a plan.
Thank you. Thank
Bye,
you very
everybody.
much. Bye, guys.